In this presentation, I will demonstrate how to give an IV push when there are no primary fluids hanging. So in this situation, patient is not receiving primary fluids. They have simply the saline lock. In this instance, we will need not only the medication, but we will need 2 saline flushes, one for pre, one for post. And I also wanted to demonstrate what your medication would look like if you were preparing it in the medication room. So of course you'll just follow the protocol wherever you're practicing. Sometimes we prepare beside the patient and sometimes we prepare in the med room. Again, in the NRL hospital, we're going to be preparing beside the patient. But when you're in the med room, we definitely need the label. And we also need to bring the vial in for scanning purposes. I went ahead and I took the fill needle off in the med room so as not to bring it into the patient room if I didn't have to. And I just used a dead ender cap to keep the tip of the syringe sterile. Okay, so at this point, I am assuming that all of my safety checks and balances are in order. I have completed all of them. And in addition, remember, before you push, act. Is it appropriate for the IV push route? Yes. C compatibility is not a concern here because we do not have primary fluids. So we can skip over C and go to T time. And I know for this medication, we have a 1-minute push time for 1 milliliter of medication. And so my game plan is to give a 1/4 ml every 15 seconds. Okay? So now I'm ready to go ahead and get started. I'm going to wash my hands, and then I'm going to get some gloves on. I'll begin by scrubbing down my hub. So I'll scrub the hub for 15 seconds. I can open my slide clamp. I'm going to attach my first flush. I'm looking to see that this is sodium chloride for injection. I'm going to go ahead, pull down, push up, to get rid of the air bubble. Remember, I can touch the plunger length because it is pre-filled and the plunger will always be behind the saline. And so I'm going to push and twist. To attach, I'm going to aspirate. For blood return, I get a nice flash of blood. And for the peripheral line, I need about 2 to 3 milliliters. And so I go ahead and I flush it. It's flushing well. So then now I'm going to hold up the saline lock so it doesn't become contaminated. And should I drop it down, no problem, just re-scrub it. And then I'm going to take my medication, in this instance Toradol, and then I am going to attach. And then I will begin the push, looking at the second hand of my watch. Incrementally, I will give the first 1/4 milliliter, and then I'm going to pause and wait for the balance of the 15 seconds. And then I will push the next increment, wait for 15 seconds, and so on until all the medication is given. Once the medication is in, then I will go ahead and post-flush. There's a very critical element to remember with your post-flush, and that is we have to assume that most of the medication, if not all of the medication, is still in the line. And so therefore we have to make sure that we give our post-flush at the same rate as the medication. So I will just continue the same incremental pace, 1/4 ml every 15 seconds. Remember, our peripheral lines need about 2 to 3 mils to clear them fully. So I will just go ahead and give post-flush at that same incremental pace for a volume of 2 to 3 milliliters. All right, and then when I get to the end of the 2 to 3 milliliter volume, that last quarter milliliter of saline, I'm going to go ahead and I'm going to slide the slide clamp closed and then remove my flush. All of these syringes, including the flushes, will go into the sharps container. So I'll go ahead and discard all of them. And then I will remove my gloves and wash my hands. I'll make sure that my patient is doing well, monitor him closely, put him in a position, comfort and safety, and now I can exit the room if he has no further needs.